Once again, good morning, ladies. This panel will be discussing the advances and progress made and the challenges in health and education throughout Africa with three key players. In the spirit of the we, I bring to you today three amazing women doing what they do in three amazing ways. And there are three women that I'm also proud to call sisters. And they're my friends, you know. These are my go-to people when I have a world challenge and I need to shrink it down to a human level and then find a world-level solution to come out of it. First of all, I'd like to introduce you to Fola Laoye. Fola holds a bachelor's degree in accounting from the University of Lagos, Nigeria, and a master's of business administration from the Harvard Business School. She's an associate member of the Institute of Chartered Accountants in England and Wales and the Institute of Chartered Accountants of Nigeria. She has over 20 years of business experience, both locally and internationally, having trained with Ernst & Young Lagos and PricewaterhouseCoopers in London. More recently, Fola, having established actually a health management organization called Hygeia, she is now the chairperson of the Hygeia Group. She has many amazing highlights, but the one of her highlights that is most incredible to me is when I reached out to her, I think 7 years back, and I said, we have a national health insurance program in Nigeria that cannot be applied and cannot be costed and cannot work. My husband then was executive governor of a state in north central Nigeria called Kwara, and I said, but we have people who need health care. Can you put your mind to this? Not only did she put her mind to it, she crafted a community health insurance program that is now the model that has been adopted nationwide for our national health insurance program. Fola. Jane Wales, what can I say about Jane? I first heard about Jane, and actually, what should I say? I should tell you, Jane is my new best friend, and I don't mean that in any derogatory term at all. Jane is head of the Global Philanthropy Forum, which is headquartered out of South Africa, San Francisco. She invited me to come to the last Global Philanthropy Forum about a month ago. And when I got there, it was like a eureka moment. I wondered why I hadn't been there before, and I wondered why more people were not doing this. Imagine a room around this size, just full of people who not only want to change the world, but are putting their money where their mouth is. The incredible convener of this meeting was Jane Wales. I listened to her. I've learned from her. In a very short period of time since I've met her, we have crafted the African Philanthropy Forum, because as I explained then, it's not that Africans don't give. We all give. But we don't necessarily give in a structured, measurable, purposeful manner. And Jane is going to be guiding us as we put together our own African Philanthropy Forum. And she has so much wisdom. I will let her speak for herself. I introduce Jane Wales. Janine Uzel, who heads global operations at General Electric. An amazing woman who nothing is a challenge to. Janine does not see challenges. Janine sees solutions. Janine, for me, is the embodiment of the we woman. In an average conversation with Janine, we can cover how to get ultrasound machines out to 4,400 midwives in rural Nigeria, and then the conversation then rounds off with who's the best person who can braid Beyonce's mom's hair. You know? That is Janine for you, and again, I don't think any of these incredible women are women that I should speak for. I think you need to hear from them for themselves, and they have so much wisdom to share. So I introduce Janine Uzel. If I can start off with the elephant in the room, which is the big MDG question. As I'm sure you all know, all those years ago, a group of men and probably a couple of women sat down and they came up with what we called the Millennium Development Goals. These were goals that were handed down to us from the command economies as targets which the under-resourced parts of the world should reach. Today, we're concentrating on 3 of those. Goal number 2, education. Goal number 4, health. And goal number 5, maternal mortality. We are in the last 1,000 days. And in this last 1,000 days, we've all been inundated with invitations to come and craft the post-2015 agenda. But we have 1,000 days to go before we hit 2015. I certainly have not given up, and these are 3 women that I believe hold the secrets to how we can make the best of the last 1,000 days in the MDGs, and where do we think we can achieve it, how do we think we can achieve it, and then begin to craft what I believe should be African transformational goals for the post-2015 agenda. So my first question to each of you will be, what do you see as the challenge today, and how best, from your own experience, do you think we can give that last push to hit it before 2015, and what do you think should be the goal for post-2015? If I can start with Fola, who works with public health and from a private healthcare perspective.
Sure, I think, yes, thanks very much, Tony. And good morning, ladies. It's great to see everybody here. I think the MDGs, especially as it relates to health. I think we all know the adage, health is wealth. And even beyond health is wealth, I think, as women, we all relate to just how much the health, our own health and the health of, our family is so critical to everything else that we do and to everything, even the way in which we are defined, the way we also sort of support the well-being around us. But I think the last part of it, too, is how much economic empowerment, again, as women, is tied into our health and into the health of those around us. I think with those major challenges and those challenges from a public health perspective being really real in terms of how many women still die every day in childbirth, how many babies, and newborns and under 5 still die due to malnutrition and just a poor access, and of course the ever-present HIV/AIDS scourge and stigma and so on. I think that the key challenge we have now in most countries in Africa, and I'll speak to Nigeria particularly, is we've done sort of too little, too late, and we are now faced with this 1,000 days, this last 1,000 days, with really, really having a major sort of push and major ramp up ahead of us to even begin to get going to some kind of, substantial sort of outcome. And I think that's one of the key lessons so far, just the fact that we got going too late. But I think also in the getting going too late, a couple of issues have been there. One key one has been how much resources have we put into this? Now, even though the MDGs have been handed down as a top-down goal or a set of top-down goals, at least in some instances, they've been a place to start. And you'll find that some countries who've embraced them and have adapted them and made them their own and have committed resources to them have made, the impact they need to. But that's not the case. In our own setting in Nigeria, for instance, health is still so under-resourced. We had the Abuja Declaration. Abuja, which is the capital of Nigeria, was the declaration of the African heads of government, health ministers, and finance ministers in 2000, committing 15% of every government's expenditure to health. And that still hasn't happened beyond, I think, 2 countries or 3 countries across the African continent. And that's 13 years later. So that's what I mean by the too little, too late. So I think one of the key challenges we have to focus in is how do we mobilize resources to really, to be able to hit some of these challenges on the head. How do we also make sure that the resources that are mobilized are included, derive some level of what I'll call inclusion, because oftentimes either the women are left out or the children are left out or, or the vulnerable groups are left out. How do we achieve that? And how do we also achieve some level of equity, and efficiency in how it's done?
Thank you very much, Fola. Now, I want to actually skip Jane for a minute and take my question to Janine, who has been working in the area of developing and getting tools out within health and education. And I'm doing that for a reason because I actually think some of our solution might be in Jane's thinking. Janine, tell me, with the tools and with the way you've been operating in Africa, what would you say are the challenges and what are the obstacles that we need to move out of the way to be able to get this success?
Before I answer that, I think what I want to say is that the reason this is such an exceptional topic, whether you're in healthcare or not, is because each of us have a voice. And so and I've been a part of even in New York, is about advocacy. And it's about women standing up for issues that matter. And so it's not whether or not you're a health professional, it's about taking on an issue that, as we mentioned, we have less than 1,000 days, not so much to resolve, but the impact of not showing improvement will be critical to the health of our nation. And although I'm American, I do live in Ghana, and so this is a part of my life as well. And so to answer this question, I am a technologist by degree. So the work that I do involves designing products and technologies that can help to solve some of the challenges around maternal and newborn health. I think some of the major issues that we have are the first levels that we tried to get past, and that is the leadership or the true people that are delivering healthcare across Africa are not our doctors, but our nurses and our midwives. And this is the front line of workers. And these are the people that have become our customers. And these are the people that we have learned to work and to teach. And so being able to empower these women, which is why this is a topic of is what's most important. These women need to have the right tools placed in their hands, and then the confidence of what they're capable of doing, even in a rural environment, completely shifts. And so if this is something that my team can provide, although GE is supposed to provide technology and devices, we're also providing confidence and training and the capability for these women to increase their capacity. In the last 1,000 days, I think our greatest challenge are not enough of us taking on the task of pushing, whether we have a voice in government, whether you have a position where you may hold a seat, like our future president of South Africa, being able to take the voice that we have and pushing to say, this must happen. We must be able to partner private, public, and work very closely together. It's something that I do on the private side of industry, saying to GE, this is why we have to align ourselves with a well-being or with another type of an advocacy group. And so it will involve private and partner working closely together. It will involve technology and non-technologist women that have a voice, whether it's in publicity, celebrity, whatever it is, to help draw a light to this. Because the way that you solve problems is you also have to shine a light on them, and you have to hold people accountable. And as you said, yes, it was a group of men that put together the MDGs, but it is a group of women that is helping to deliver them. Exactly. And this is our place and our time to get it done.
Thank you very much, Janine. My question to you, Jane, is simple. I have seen, when I've traveled around the world, I become jealous, actually. I go, say, in New York, and I see a major hospital, and it's called Sloan Kettering. It's named after a person. But where I come from in Africa, a lot of the things that are trying to drive innovation are still public sector funded. Meanwhile, you are working in an arena where the private sector, as what we call effective philanthropy, is the one taking the risk. How do we get our own people, how do we get our own homegrown philanthropists to be able to put things down on a scale that can be given to the public sector and used successfully? What are the secrets to making people give and give effectively?
First, I would say the answer is to expand the numbers and collaborate. But let me just first say, Toyin, that one of the great joys of my life is getting to know you. I was very fortunate. And I have to reflect back on the previous panel in which we talked about African women being redefined. When I see you, when I see the women gathered here, I see warmth, I see brilliance, I see beauty, I see giving, and these are not the attributes of the weak. These are the attributes of the strong. So I don't think African women need to be redefined. They just need to be known, right?
Yeah.
So on the philanthropic side, let me just say that we have one of the wonderful things about the MDGs is they've not only focused governments and persuaded populations of the importance of these objectives, but they've also engaged the private sector, as you have noted, Janelle, and but they've also gained the attention of the philanthropic sector. And as a result, for example, the Gates Foundation helped drive the creation of new financing mechanisms, such as the Global Fund to fight AIDS, tuberculosis, and malaria, or such as GAIN, which is Global Alliance for Improved Nutrition. I'm very proud of myself when I get these acronyms right. And now what we're seeing is the emergence of philanthropists throughout the continent of Africa. And by that I'm talking about people who are willing to use all their resources. That means their capacity to make grants, their capacity to invest, their capacity to give voice and to use their voices in the political halls of power. I believe that this is, well, I mean, I'm going to sound immodest here, but I believe Africa will meet its own development objectives. Maybe not today, maybe not tomorrow, but in our lifetime, in part because of the emergence of philanthropy, activism, and voice, led in part by women.
Thank you very much. The other thing I believe, actually, and it's, I'm quite pleased we have emerging political leaders here. I believe that the functionality of any democracy will be measured as to how that democracy treats its women and its children. When we're looking at the MDGs from a women and children's point of view, I think we cannot just go from what education you're giving women and children. We cannot just go even from the healthcare provision you're giving women and children. One very secret and one very silent burden that I believe is a universal challenge, actually, in many, many countries, for women and for children and for families, is MDG 3, the eradication of domestic violence. We all know domestic violence thrives on silence. At the same time, we know, like many other challenges, as Janine said, if we shine the Klieg lights on something, it begins to highlight that thing. In which ways do you feel within your sectors that we can tackle this scourge of domestic violence? Because this is something that is overbearing upon women, and it is reducing women's productivity. If you have any experiences of successful interventions, I would love it if you could share it with us here. And in the question and answer session, if we can bring out some champions who are ready to speak out on this, I think this would be also very great for domestic violence.
Sure.
I know it's the elephant again in the room, but I have to throw it out at you.
No, thanks, Toyin. And I think that, these are some of the less spoken, as you say, about challenges, but are really important ones. And certainly from a healthcare sort of delivery and a healthcare system point of view, these are the things that we are beginning to find the need to support, to offer some level of support, some of it being counseling support to women who are going through these types of issues, but some of it also sort of giving them this sort of physical sort of, well-being, not necessarily to go back and fight back or throw the next punch, but to go out there now and become a little bit more economically empowered. Because in most cases, domestic violence does happen where the economic balance is certainly very much against the favor of the woman, in the home. So to the extent that women are able to not just, make their own money, but also hold on to their own money, because very often when they make their own money, they can't hold on to it. either because they give it to their husbands or give it to whoever is the dominant male in the household. But then realizing that they need to make it and hold on to it, even if it is using the fact that they have to put it into some kind of social program, which then helps to support health and education for the family and for the home, all the different sort of community programs that now exist. It does help them in some way to start to at least break free of some of the shackles. But I have to say that that's a subject that, we are not real experts on, but we certainly have seen that in everything we've done to empower, women from the perspective of being able to take hold of their own health, it certainly, helps quite a bit to free them.
Yeah. So one solution that I'm picking up from this is basically that financial empowerment is at the basis of a woman's entitlement and her right to well-being. If a woman is economically empowered, it puts her in a better position to be able to help herself. Now, we've been talking about the midwives. We've all agreed that where it comes to health service delivery for women at their most vulnerable period, which is during pregnancy, the midwives are the frontline deliverers of that. But again, I know in my country, the midwives are the forgotten majority in healthcare. They're the ones that are out there dealing with the women all the time, but they're also the ones that don't necessarily have simple things like the transportation, the equipment at their fingertips. Janine, from a GE point of view, what can you do to help us empower our midwives, who are the ones, after God, because in Africa we always give God the glory first. After God, the midwives are the ones delivering life. What can you do to help us empower our midwives?
There's over 230,000 midwives in Nigeria alone.
In Nigeria.
Just in Nigeria. And I don't know the containment of where the majority are, but over 230,000 that are responsible for healthcare. What I can say is that whether it's domestic violence, bullying, just not making friends, anytime that you tear down the character of a woman, you tear down the fabric of society. Because anything and all of who we are, my sister, she just walked out. She gave me some advice today. I came in and she said, why don't you put your necklace on the outside? It would look nicer. And instead of saying to her friend, why is she dressed like that? Anything that you can say to encourage or to enhance someone, it matters because it helps make us all better. And the world is very big, so there's enough room for all of us to have our success. And I'm going back to the midwife to say that the challenge with the midwife is she wants so much to do her job well. She wants to see a mother survive. She wants to see a baby survive. It's what she takes most pride in, and these women trust her. However, she's forfeited many, many times, one, by the very limited number of doctors, because we all know that there are more African doctors in Europe maybe than there are even in Africa. But the minute a doctor finds out, a general practitioner or a GYN finds out that a nurse midwife may have the capacity to gain her own fiscal strength by learning something as simple as ultrasound and possibly owning something as very basic as an ultrasound the size of this recorder here, they now become defensive and say, we don't want the nurse midwives to deliver ultrasound. They're taking our customers away. They're taking our patients away. But these are not the people that want to serve in the environments where these nurse midwives are willing to be. I come from a family of doctors and medicine, so I debate this often with my sister. She's like, no one wants to take jobs away from midwives. In environments where they think it's going to affect their income, they do. And so the most important thing we can do is the very thing that society doesn't want us to do, which is educate. Because when I was at ICM, the International Confederation of Midwives, I put this device in the hand of a midwife, and she almost fainted. And she just said, my whole life could change in a matter of moments if you just let me have this. And so if we take something as very simple as training and then increasing their confidence, bolstering the capability of what they have to do. These women are sitting in a room where there's no electricity, there's no running water, there's no light. You can power this, these technologies on solar units and things like that. Where do we hold a company like GE responsible? This is my forum where I go fight every day, right? This is my government. To go back to the private entity and say, we have to do something that matters. The 67.8% of Africa that's rural, how do we service them? Our company is doing that by saying we will put funding into reverse innovation. So how do we take a product like ultrasound and make it easy to use, easy to afford, make it so that it can treat the continuum of care? Yes. How do we partner locally to say, in order for this to work, we need to have a cash voucher with a local bus in town that can bring these women so that they don't have to walk the 10K to their homes? And then how do we take our message to the community, which for one of the times when I had to spend time in a village and actually learn, how to have a conversation with the chief so that he could say it's fine for a woman to go have a scan so that she could come in and make sure that the baby was fine. And our biggest success was the very first time in rural Tanzania when a husband brought his wife into one of our health centers, and he said, something's wrong with her. And I thought that was life-changing for the husband to even bring her. So if we can educate and if we can continue to challenge ourselves as a device company to create products that can be used. But I also think that an area where we need to improve is in our advocacy. We need to stand up more. And we've said we're a device company. Let's not make too much of a stink about this. But GE is a big enough company to stand up and say, we want to push towards MDGs 4 and 5 and change the face of the world. And so I think I know that we can do that, and we're just working towards that.
Thank you. Jane, one thing that I always noticed was I would go to global meetings and we would talk about a goal. But when I got back home, it would be very difficult for me to explain to the women that we were trying to have the impact on exactly what the goal was. Because to be honest, to the average woman in a village, she doesn't even know what MDG 4 is or MDG 5. The challenge was always in translating this into a meaningful way for these women in their own lives. And now we're beginning to create this buzz around demand creation. Because the truth is, no matter what we put down from the top, if the women don't know what it is, and if they don't want it for themselves and see it to be something of value, how are we really going to achieve it? And I just thought to myself, this might be a role for the philanthropists, who are normally actually pillars of their own societies. How can we engage philanthropists in the forgotten pillar of demand creation, which actually makes a midwife want to hold a portable ultrasound, a woman want to access health insurance, or even a lady businesswoman to know where to get the SME funding? What role can philanthropists play in putting together an infrastructure and a platform for this? Because we know the risk is taken by the private sector.
So you're helping to define the difference between charity and philanthropy.
Yeah.
Because you rightly noted earlier that Africans have always been giving, always been generous, and it's simply a matter of how organized and structured that generosity can be. And certainly, charity tends to be about the supply side. It tends to be about addressing the consequences of lack of proper health care, lack of proper education, lack of rights, for example. And the demand side, philanthropy tries to both get it, do some treatment of the consequences, of course, but get to the causes and recognize that one of the solutions will come from women themselves, women and others. And this is what the Wellbeing Foundation is so well known for, is for developing that agenda for the demand side. Let me say something about knowing what MDG 1, 2, 3, 4 is. The woman in the village doesn't know perhaps that phrase, that category, but she lives it. Yes. She lives it. And the great frustration, the good news and the bad news about maternal health and maternal and child health is that the equipment exists, thanks to companies like GE that have done the innovation, done the basic research, brought about the technology, but not everyone has it. And so I'll give you one example of what philanthropy has helped do. around the world who are designers and builders of equipment and anything else, you name it. And by connecting the two, we can have equipment that is locally designed, locally prototyped, locally sourced, and locally provided to those most in need.
Wonderful. Thank you very much. I think I have a time up from...
Exactly. I just want to get the mic around here so that we can also have some questions. I mean, I'm hearing some exciting things. For now, I want you to start tweeting right away. If you tear down a woman, you tear down the fabric of a society.
Absolutely.
Send it out right now. And don't forget to hashtag We Africa. Do you want to hear it again? Oh, use your phone, girl. Oh, you're not roaming. I'm sorry. Okay, let's get some questions to the panel, but some exciting things I'm hearing. Here's
Tonya,
someone
before we
there.
take a question, I just want to say one thing. And
Yes,
this is a
please.
challenge for all of us that are here. And I don't know all of the different organizations, but
Yeah.
when we talk about women's health, it's something that should be a revolution. And whether it's something you do, maybe at well-being, I'm saying it now, we're going to get, for when we go to the UN, we're going to wear countdown T-shirts or something.
Yeah.
But it's something that you can do, whether it's in your organization, your home. But if every one of us took a thought around how to help someone in their community, in their village, then we can address this problem. And we don't have all of the answers. But what I know is that it doesn't take a lot of other women from other societies to come to Africa and tell us how to solve the problems of Africa. Although I think that what they do is wonderful, we can do that ourselves here.
Yeah.
And we can raise a stink, and we can start a revolution right here and make the global world pay attention. Because that's how China's done it, that's how India's done it, and they've met their goals, and they're saving the lives of their women because their women matter to them.
Yeah.
So basically you're saying that we must now bring out our own African solutions for our own African
And
challenges.
our own African voices,
Yeah,
and let our
African
women
voices.
know that they matter to us. And if the rest of the world won't help save their lives, because you don't have to know MDGs 4 and 5,
Yeah.
you don't have to know that there's 494 women in Nigeria dying for every 10,000
Yeah.
that give birth. What you have to know is that a woman gives birth, a woman gets pregnant, and she's immediately goes into fear because she's going to die. And if she does get pregnant and she doesn't live in the local city, and even if she does, the likelihood of her dying is 70%. That's all you need to know. That someone could get pregnant and they might not live, and possibly you could find a way to help that person.
Wow, absolutely. Fala, you had some
And I was just going to say that absolutely. I think if I can craft it in that there is something between what Janine is talking about regarding that advocacy and that voice, and what Jane is talking about philanthropy. There is actually a meeting point of both. And we as women particularly are really well placed to bring the two together. And not just the two, but also to use the power of the two to then become a bit more sort of, magnified, either because you can bring commercial enterprise along with you, or you can also bring government along with you. And I think that's really has been the, shall I say, case study of the community program that we ran and we're still running in Kwara. Because essentially, there was a need, a problem. We applied our minds to it. We used the advocacy platform that was available to us. And most of that advocacy platform was actually the women themselves, the children themselves saying, look, we need this type of system. What can you do to get it for us? And we used that voice and we took it to a philanthropic community who said, yes, let's see how we can create, some kind of at least support for the innovation. And that now has become, it's taken a life of its own. And now we're talking universal health coverage.
That's true.
So it started from such a little nugget of an idea, but with very much the power of speaking out, as well as really being able to sort of speak out also with the right language, with the right tone. Because I think sometimes as Africans, we also ignore the need to make sure that it is put across in a way where it is understood, as you said. It doesn't have to be technical. It just needs to be understood. Everybody relates to it. Everybody connects to it on some level. And certainly also think about how to make sure that you're not just sort of, shall I say, given in a helpless way, but in a truly empowering way, where, like I said, commercial enterprise and so on can also come out of it. Because I think that's the other key in the puzzle properly. And once you have all those different pillars in place, then you've just got to keep talking about it. You've just got to keep shouting, you know. And I think that's the way of the future, and that's the way of ourselves as Africans being able to change the status quo.
Where's my timekeeper? How much time do I have there? My timekeeper ran away. She's doing now. 5 more
We've got
minutes.
5 minutes.
Okay, I'd like to get 1 or 2 questions in. I think there was a question there. You have a mic? There we are.
All right. Hi, my name is Karen Warner. I work for an organization called Global Health Corps, and one of the reasons I love the scope and breadth of this conversation is that our organization is really interested in engaging a diverse community of young leaders who are coming from different backgrounds and different fields to work on these issues in a holistic manner. And so my question for you has to do with post-MDG goal setting and how we go about balancing the need for goals that are, you know, addressing systems-based approaches or looking at the intersections between these many issues that we're talking about, from gender-based violence to maternal and child health to nutrition to education, and how all of these things intersect. And as you know, one of the strengths and criticisms of the MDGs are that they're very clear and simple, but that also means that there's a little bit of siloing of these issues. And so I'm interested in your thoughts on how to do effective goal setting as a global community and as individual organizations and stakeholders, so that we're pushing ourselves to set goals that are measurable but are looking at these intersections that are systematic.
So the post-2015, there are several meetings that have been taking place for about a year, and we're still writing how that will work. I can say that maternal and newborn health will carry over post-2015. They're just going to repackage it and probably give it a different name. Non-communicable diseases will become a big part of that, and then also health system strengthening for the continuum of care. But whether it's going to be done in a set of goals and very similar to the MDGs, it hasn't been defined yet. But the MDGs were a starting point, and they made people sit up and listen. So there is criticism on how it's delivered, but at least we have some movement now. So my suggestion, particularly because I know your organization, would be also that you work to have a member of your team that can become a part of the organizations we are, like PMNCH and the MDG Health Alliance. These are the organizations that are looking for feedback from people in the field to know exactly how we redesign the post-MDG strategy. And it'll take the likes of us all, private, public, and then really the hands on the ground that are delivering this work, so that we can figure out the best way.
Okay, I'm going to ask you for 30
Jason?
seconds each, really, as you sum up.
So I will, in fact, sum up by answering your question.
Yeah.
And that is to say that you're absolutely right about the interactions amongst the issues and the need to look for kind of cross-cutting concerns. But let me just say the single most important one to bear in mind, in my view, is that not one of those goals can be achieved without the empowerment of women. So I would almost want to write the next round as, given that the empowerment of, advance the status of women so that we can, and then list the other goals. But it's foundational. And so that would be my full comment on that.
I think on this issue, the fact that the post-MDG discussion and the dialogue is being done from a bottom-up perspective, and one that is being extremely inclusive, means that we can seize the power. I think we as women should get more involved. I think there's all sorts of platforms now that have been put in place, including the technology platform, My World, and so on. I think it's something that we just have to seize the moment and not wait for, the opportunity, for people to ask us. I think we have to go. We have to demand our seat on the table through, conferences like this and so on, to really help to frame what that future will hold.
I'm going to ask you a question, and then if you don't mind, Your Excellency, can you just sum it up?
Hi, Connie Jackson from Fashion Fair. I'm like to, as you're thinking about the post-2015, I think there needs to be an integration of the developed, so-called, and developing world, because to be honest, in the United States, a black woman is 3 times more likely to die in childbirth than a white woman, no matter her education or income level. So this is not just about some village in Africa. This is about Detroit and Chicago and rural South. So it would be great to hear how we can integrate the world of women of color in these goals, and not just about sort of where the women happen to be.
Thank you. If I could sum up with a call to action.
Well,
For many of you in this room, you probably are listening to us talking about mortality rates and death, and you probably first say a little prayer to yourselves, oh, hopefully not me. And then, you listen to what we have to say. So I just need to share with you the reason why I do what I do. I think we are the lucky few here. The fact that we're here means that, we had the right education, we lived in the right environment, we had the right enlightenment. But let me just share something with you. When you're sick in a country, or you run into a medical challenge, that is actually the point where what you are and what you have makes very little difference. At the point of emergency, we have what we call the golden hour. And in that golden hour, what you encounter and what happens to you is what will determine whether you will live or you will die. 21 years ago, I had it all. And I thought I had it all, but I encountered what the have-nots encounter. I nearly lost my life in the process, and I lost the life of one of my children. So I promised to help other people. Just 2 years ago, a brother of mine, who also had it all, again encountered these infrastructural deficiencies and paid for it with his life. So what I want to ask you all in this call to action, don't wait to encounter it. If you raise your voice along with ours to help the infrastructure get better, if every pregnant woman you see, you just stop and ask her, how many visits to the hospital have you had? And if she hasn't had 4 and she looks like she's 8 months pregnant, just ask why. Because you're all very well-connected women. Even if you can't deliver that care or you're not going to pay for her treatment, chances are you know somebody who can. Every life saved is a family saved, is a community saved, is a town saved, is a country saved. Please, raise your voices. Thank you.